So, good afternoon, everyone. Today, the last. Am I audible clearly? Am I audible?
Yes, sir.
So, today, the last aphorism of case taking, we will deal with the 104. It's regarding the record keeping. Record keeping is important in more than one senses, and how to keep record is very important than keeping the record itself. Okay, so because of our less space at our chambers, usually those homeopaths having small chambers like you are seeing this, we used to follow the prescription itself. I have a A4 size paper with me, my prescription A4 size paper, and in both sides I used to take the whole case and give it to the patient and ask them to bring it back when they are visiting us next. But in this type of record keeping, it is I though I have some this type of record also here with me, means unorganized records are there for some people who are constantly losing their records. Okay, so one danger in keeping records in this sense is that the patient will lose the record again and again, and you have to work hard again. But if you have space enough to record keeping is important, but the way you keep the record is another topic. Okay, so you have to keep the record of your patient. There are different ways to keep. You can have a bond journal where as per hearing suggested that a bond journal this much thick size book, and you record with a reference number to your patient. You may have a slit like where you can put slit nextly. Whenever that space is full for that patient, you will insert a slit that other stalwart have uh, advised. Okay, so that is the other thing, how to keep the record. Okay, but you have to keep the record anyhow, because it is important to refer it back whenever you are seeing the patient again. That is not happening with the allopaths. Okay, previously allopaths used to have records, maybe 20 years or 30 years before, or in the modern days hospitals they are having some sort of record keeping methods, but it is an integral part of homeopathic practice to have record with you. Okay, so how to keep the records, it up to you. So we are today, we with this preamble we will study record keeping. Okay, open Kent's lecture, the chapter record keeping. 179 page number in my book, it is 179, chapter number 27, chapter number 27. Just Rashmi, can you read for us?
Yes, sir. Aphorism 104.
No, this is record keeping from Kent's lecture.
Oh, I don't have that right now. Sorry, sir.
Okay, anyone having?
Yes, sir, I have.
Okay, can you read for us please?
Yes, sir. You should endeavor to have a good knowledge of both the acute and chronic miasms First of all, the image of Sora should be studied from all the symptoms that we can gather, and especially from the
Actually,
symptoms.
it is including 103. What we have read in 103, it's include that. Okay, so read that also.
Okay, sir.
Please read. Please go
Hahnemann,
on.
Hahnemann
No,
has
no.
given in
Yes. Hahnemann have given.
Hahnemann
Yes,
has
please go on.
given
Please go on.
in the chronic diseases. Next, we have to make out a similar anamnesis of syphilis, which can be done from books, from clinics, from observation, and all other possible sources. And then an anamnesis has to be made of psychosis. These are things most general and will bring before the mind in one, two, or three images a grand picture of all the chronic diseases of the human race.
What we have discussed
Takes
yesterday, that Hahnemann have given the picture of Sora, but the picture of psychosis and picture of syphilis is missing from his writings. So how it can be constructed? How it can be constructed? We have discussed that it can be constructed by clinical observation. Underline that, from books, from clinics, from observation, all other possible sources. Okay. Now go to second paragraph.
Take Sora first, for that is the very foundation of human sickness. It would appear that the human race is one innermost leper. Now add to that the state of syphilis, and we have a bad matter made worse. Then add to that the state of psychosis, and we will see the extent of human sickness. We then have to advance and carefully study each of the acute miasms from the books, from observations, and from every source of information, carefully arranging it on paper so that it can appear before the mind as an image.
Okay. Each
Smallpox.
acute miasm. How many acute miasms are there? You don't know actually. Okay. You have to study diseases which are fixed in their character for a easy handling. That is 103. That is 103. That how to construct the picture of chronic diseases, to how Hahnemann have constructed the picture of Sora, you can construct the picture of all the acute miasms. And how many acute miasms are there? We don't know. That is why there are people who are claiming that there are altogether 25 miasm, 26 miasm. They are confusing between these acute miasms and chronic miasm, firstly. And nextly, they are confusing that HIV, they are telling an acute a miasm, a chronic miasm. Okay. HIV, malaria, they are telling a chronic miasm. Okay. Regarding HIV, it cannot be an acute miasm. It's a if it is a chronic miasm, it should pass on from the stages of primary manifestation, from the stages of infection to primary manifestation on the external part, then the secondary manifestations. Okay. So to pass the test for being a miasm, these are the criteria. Okay. And next, they are telling that typhoid is a miasm. Yes, typhoid is a miasm, but not a chronic miasm. You can tell it acute miasm, and still it is accepted. Okay, like chickenpox, typhoid can be a acute miasm. Okay, having fixed criteria, having fixed symptoms. Next.
Smallpox has few features, and it can be made to appear as an image before the mind, and so with all the acute miasms. Infectious
Smallpox,
diseases,
Kent is giving the example of smallpox. You can take measles. What is the pathognomic symptoms of measles?
rashes, red rashes.
The pathognomic means red rashes is also present in chicken pox, you can say, smallpox, you can say.
Hmm.
The red rashes is any arterial eruption of the skin may be present. Pathognomic means which is characterizing this measles. Whenever there is measles, this coplic spot should be there. A white patches inside the buccal cavity, inside the cheek. Coplic spot near the molar, near the second or third molar is coplic spot should be there to characterize it as measles. So this coplic spot is fixed. This coplic spot Okay. Aphorism number 104 we are 104 we are discussing. Anirban, 104 record keeping from Kent's lecture. Record keeping, chapter number 27. So this characterizing the measles, Koplik spot. Okay. So this whenever there is measles, this symptom is there. Okay. Whenever there is measles, whenever there some type of acute miasm, there are some symptoms which will be always be present. Okay. And there are symptoms which may be present in one or two cases, but there are a group of symptoms. The disease will not expand from that group of symptoms. If there are altogether 100 symptoms for measles, the measles will not expand from these 100 symptoms. Okay. Next.
The diseases that have heretofore appeared in epidemic or endemic form, these have all to appear before the mind as images. It may be said of them that they are all true diseases seen by the examination of the totality of the symptoms. No physician can know too much about the image of a given sickness, studied from the symptomatology, and this is the best information that can be obtained. Nowadays, patients are not permitted to tell their story in the language of nature. The physician says, "I do not want to hear that." Talk on the part of the patient interferes with his prescription writing. There is no writing down of the case.
Okay. Now I want you to open 104 footnote. 104 footnote. Second footnote means 104 footnote. Please read it.
The old school physician gave himself very little trouble in this matter in his mode of treatment. He would not listen to any minute detail of all the circumstances of his case by the patient. Indeed, he frequently cut him short in his relation of his sufferings, in order that he might not be delayed in the rapid writing of his prescription, composed of a variety of ingredients unknown to him in their true effects. No allopathic physician, as has been said, sought to learn all the minute circumstances of the patient's case, and still less did he make a note in writing of them. On
Okay.
seeing the patient,
This is fact. This is the fact till the moment we are living. Till the time we are living, this is the fact. You see the prescription of an allopathic physician, and you will see that he is just writing the prescription, not noting down the clinical details. Okay. Few conscious physician will write down at least BP, pulse, weight. Okay. That ceremony of writings are there, and no other findings, no clinical examination, what he has found at clinical examination, they will not write. Okay. This is not a good practice advocated even in the modern school. But this is the fact that they are very busy. There is actually, you cannot blame them for not keeping the record. There is a doctor patient ratio, means some physicians have to see 100 to 200 cases a day, but that should not be an excuse for record keeping. You should keep record even at the expenses of keeping a assistant for you. Next.
on seeing the patient again in several days afterwards, he recollected nothing concerning the few details he had heard at the first visit, having
This
in
is
the meantime
one of the demerits of not keeping the record. Okay, physician have seen in between lots of cases, and he must have forgot that what was the case. Okay, that is the one of the demerit of not keeping the record. You will get a whole question in your examination on record keeping. You can utilize these points.
Having in the meantime seen so many other patients laboring under different affections, he had allowed everything to go in at one ear and out at the other. At subsequent visits he only asked a few general questions, went through the ceremony of feeling the pulse at the wrist, looked at the tongue, and at the same moment wrote another prescription on equally irrational principles. or ordered the first one to be continued in considerable quantities several times a day, and with a graceful bow he hurried off to the 50th or 60th patient he had to visit. In this thoughtless way, in the course of that forenoon, the profession which of all others requires actually the most reflection, a conscientious, careful examination of the state of each individual patient and a special treatment founded thereon, was conducted in this manner by persons who called themselves physicians. Rational
Yes.
practice, practitioner, the result, as might naturally be expected, was almost invariably bad, and yet patients had to go to them for advice, partly because there were none better to be had, partly for fashion's sake.
Okay, this is statement is still true. Uh, how much knowledgeable Hahnemann was for the with the human nature. Okay, he was having so much knowledge of human nature that he is predicting this uh, 200 years ago, and still it is true that बड़ा डॉक्टर है उसको दिखाएंगे, है ना? सब उसको दिखाते हैं तो हम भी उसको दिखाएंगे. For the fashion sake and many of the daily activities we are doing is true. We are doing for the fashion sake only. Okay, many of the daily activities we are doing in 24 hours. Just underline how many things are actually needed and how many things were not needed, but we were doing it for the fashion sake, or how many things which were needed but has been exaggerated for the fashion sake. Okay, from शादी की दावत से लेके कपड़ा and घर, हर जगह for the fashion sake we are doing things. Okay, this is a basic human nature. Okay, so that is another topic, side topic for that. But Hahnemann is pointing out two things, but two things why still the patient is going to that doctor who is not listening him carefully, who is not keeping the records, because there are nothing better to have. Number two, for the now return to the chapter of Kent, record keeping.
Now take for instance one of the clinics here. How would you remember from day to day and from week to week what had been given to each patient? There is no importance attached to that in the old school. It is simply their object to give the patient a big dose of medicine. It may not have occurred to you that there are several reasons of importance for keeping records and of constantly referring to them. Even the regular clinicians here may not have seen the full importance of it. But suppose a patient that I have been considering for 3 years is partially cured and she has done remarkably well, has been restored from an invalid to a good wife and mother, but is not yet cured. Now for some reason she goes into the hands of another homeopath. What can he do without ascertaining what I have done for her? It is important for the patient when living in the same town to be faithful and true to the physician who has done her the most good. A conscientious physician will not feel like taking another doctor's practice in that way. I am not so conceited that I should feel like taking up the work of another doctor who is able to do good work. Men who think more of getting money than anything else will jump in and prescribe for your patients. The
Okay.
physician out.
So, when the patient is coming from the other homeopath, fellow homeopath, and if you see that the fellow homeopath was was a good homeopath and have advised the correct medicines to your patient, and your patient was improving under his hand, it's better to ask the patient to continue that treatment if he or she can. Okay, if he or she cannot continue that treatment, you will better to ask that fellow physician that what sort of medicines he was giving, and if he was a good homeopath, he must be a good human being also, and he will cooperate with you. Okay, so this is the practical tip you should practice while practicing in your town or while practicing in your community, you will get such cases. You will see a good allopath also is means there are good allopaths or good surgeons also. For the all the practical purpose, you should have a good relation with them. Okay, you should have a good relation with the surgeons, with the dentist or fellow allopathic practitioners. Okay, they are not your enemies, but the main thing what homeopath suffers is rivalry amongst themselves. Okay, another homeopath is talking bad mouth about another homeopath. That is not the ethical practice. To chhodi do, that is not ethical at least sense, and not is not going to help you practically. Okay, if you are seeing that that physician was good and your patient was improving under them, you should refer you back the patient to them all only. If he or she can continue under them, that will be a good, and that will have a good impression of you. One of the physician practicing nearby, a homeopath physician practicing nearby, and I used to see his patient, lots of patient coming to me, and I am referring back those patient to him. Okay, some patient was complaining that he is bad mouthing me for no reason. I know that patient were coming returning were returning to me. So be honest in your, actually be honest in your practice, that if he's good, tell good. If he's bad, don't bad mouth. Okay, this is a practical tip for running a clinic. Okay, so you should make it your principle, never bad mouth your colleagues practicing nearby or practicing anywhere. Even if they are not good, keep mum and treat your patient. If they are good, refer back the patient to them only, that under their treatment you are good, you should be treating, you should be treating yourself under their care only. Okay, this is the principle. Make this principle for your life. Next.
The physician ought ever after to have this image before the eyes to serve as a basis to the treatment, especially where the disease is chronic. Without records, you are at sea without compass or rudder. With a record, Hahnemann says, he can then study it in all its parts and draw from it the characteristic marks. That is,
Okay,
you
do you
have
like
the
this?
nature That is, you have the nature of the disease continuously in mind. When the image of the disease has passed from mind, its very nature is gone. Here a point comes in you must know about. After your first prescription has been made, you may have an aggravation. It is well to know the date of this and about how long it lasted, and to keep watch of it. If no change has occurred, the same image may continue to appear before the mind, but if changes have occurred and are continuously appearing in the symptoms, you will readily see that no medicine can be administered. The symptoms that come and go could not guide anybody as to what to do. Now a commotion has taken place. You cannot prescribe while this commotion is going on. The symptoms are changing place. They are coming and going for perhaps 1 to 3 weeks after that prescription. You have to watch and
Wait,
wait.
what actually he's saying? What actually he's saying, that without the record, you will be unable to analyze for the second prescription. Okay, in the second prescription, we will read that when the constantly a change is taking place, you cannot prescribe on those unstable states. Okay, you should not interfere on those unstable state. Okay, if the patient is complaining of symptoms which was after your medicine, there was altogether a silence, you put a medicine and there are symptoms which are coming and going, coming and going, you cannot prescribe without a record. Without a record, you cannot say that whether this is a new symptom or old symptoms or there is an aggravation. Okay, that is why the record is important. Next.
Notice when the symptoms begin to roll into order, then another dose of medicine is needed. These things take place only after the administration of a remedy that was pretty high enough to take hold, and the case falls into order only when the patient needs another dose. Suppose a patient has been sick 3 to 4 years with a train of symptoms, and on the way to visit you from a long distance, the patient is taken worse, and a homeopathic physician is called in. The patient gets a dose of medicine and improves wonderfully. Now what are you going to do? You do not know what is was and you write to the physician. But he has forgotten what it was. What a confusing state that is it not? Well, that is just the state you would be in without your records. There is,
Okay,
I have been.
underline this. This paragraph is important for your answer to your university examination. Okay, this is a point. Next.
There is, I have been led to feel, too great carelessness often among our best men in transferring cases from one town to another, from one physician to another, a habit that has existed between another Hahnemannian and myself has been pleasing to us both. When one of his patients has been transferred from his care to my care, he has told me what remedy the patient was on, and I in the same way when sending patient to him have mentioned the remedy the patient was on. It is the duty of the physician to furnish such information when a patient leaves the city to go under the care of another physician. It is the duty of the physician to transfer such a patient to good hands if there are any good hands to transfer him to. This subject is preliminary to the observation of aphorism 105, which leads to the second step of practical homeopathy.
From here starts the second step of practical homeopathy. First step was knowing the disease, what is to be cured in disease in general and in particular. We have discussed in general, and now we have completed the discussion on in particular. Okay. Before ending that disease, knowledge of disease in particular, Hahnemann emphasized on record keeping in 104. Okay. Now go to 104 and read it.
When the totality of the symptoms that specially mark and distinguish the case of disease, or, in other words, when the picture of the disease, whatever be its kind, is once accurately sketched, the most difficult part of the task is accomplished. The
This is often
physician
a
has.
question in your university examination. This is often what is the most difficult part of the treatment. Okay. Elizabeth Wright is telling that once the accurate case taking has been done, half the work done. Okay.
Okay. The physician has then the picture of the disease, especially if it be a chronic one, always before him to guide him in his treatment. He can
Underline this.
investigate it.
Always before him to guide him in his treatment. It is better to put sometime we prescribe on mental basis. We ask the patient what is the symptoms, and we prescribe without keeping record. After that, when patient comes back to us, we forgot what medicine we have prescribed. We forgot what were the symptoms, and patient as well prescribed. So in acute disease, sometimes it is possible to prescribe without any record and without any a prescription. You can prescribe sometime when there is a rush hour, you can prescribe, but especially in the chronic disease, you should not forget to take the complete case, and you should not forget to record the case.
He can
Next.
investigate He can investigate it in all its parts and can pick out the characteristic symptoms in order to oppose to these, that is to say, to the whole malady itself, a very similar artificial morbific force in the
What is
shape
this?
of a homeo.
What is this? Very similar artificial morbidity force. What is this?
Very similar artificial
Medicine, remedy.
medicine, yes, a remedy which is given to the patient,
Remedy,
which
medicine.
was
One,
given to the
two, three,
patient.
four, five. Okay, similar medicine. Five word Hahnemann is using instead of saying remedy. Okay, this is the uh, mode of organon. This is the way of organon. Okay, that is why it is somewhat difficult. Five words for a single word. Actually, German language is like that only. Next.
in the shape of a homeopathically chosen medicinal substance selected from the list of symptoms of all the medicines whose pure effects have been ascertained, and when, during the treatment, he wishes to ascertain what has been the effect of the medicine and what change has taken place in the patient's state. At this fresh examination of the patient, he only needs to strike out of the list of the symptoms noted down at the first visit those that have become ameliorated, to mark what still remain, and add any new symptoms that may have supervened.
So this is enough for case taking, for record keeping. Along with this 104 and the record keeping chapter in the Kent's lecture, it is enough to emphasize the importance of case taking. But how to keep the record, it is up to you. Whether you are using the prescription and giving it to patient, and whether you are using computerized system, whether you are using hard bond journal, or whether you are using slits, it's up to you. Now we will start. Any question till now? Any question?
No, sir.
Okay. So we will start from here. This is the second business of physician. Okay. See aphorism number 71, and you will find there are three uh, three businesses Hahnemann have discussed. Hence, the operation of curing is comprised in three following points. Number one, we have completed what is necessary to be known in order to cure in disease. What is the knowledge of disease? The knowledge of disease we have subjugated in two parts: knowledge of disease in general and knowledge of disease in particular. We have told that aphorism number 3. From aphorism number 3, the whole organon have been erupted or evolved from aphorism number 3 up to you will see the theoretical part. In the theoretical part, again Hahnemann is discussing those points in theoretical part in brief. Now from practical part onward, Hahnemann is again discussing those points in detail. Okay, knowledge of disease in general in detail, knowledge of disease in particular in detail. Particular means the knowledge obtained during a individualized examination of a case. Okay, so we have completed knowledge of disease in general, knowledge of disease in particular. Now number 2 was, how is he to gain the knowledge of instrument adopted for the cure of natural disease? Here only the knowledge of instrument, how he is going to adopt in general, have been dealt in the pharmacy part. Okay, we have told that knowledge of medicine in general. What is knowledge of medicine in general? Their kingdom, their chemical reactions, their mode of collections, their mode of preparations, all these are knowledge of disease, knowledge of medicine in general, that has been dealt in the pharmacy part. Okay, the pharmacy part of Organon, you will see that number 264 to 268. Okay, 264 to 268. To some extent, Hahnemann have described the mode of preparation, mode of collection of those genuine medicine from 264 to 268. Okay, and 269 to 271. Mode of preparing crude medicinal substance peculiar to homeopathy. You can see, you can take 264 to 271 completely. 264 to 271. This is knowledge of medicine in general. In general. Okay. 264 to 271. Okay. In it come the cleansing also. How to clean the instrument which we are using in our pharmaceutical laboratories. Okay. So this is the knowledge of pharmacy, knowledge of medicines in general. I hope you are getting what I'm trying to tell you. Next, what is knowledge of medicine in particular? As every disease is individualized, every medicine is individualized. Okay, and how to obtain these knowledge? The therapeutic sphere of medicine. How to obtain this? So this is very peculiar to homeopathy. This drug proving is very peculiar to homeopathy. Before, what happened, we have discussed this to some extent during our discussion in introduction. Okay, what happened before, those who are discovering specifics, okay, those physicians, older physicians who are discovering specifics before, they were discovering it by chance. Clear? Those who are discovering specific before, they were discovering it by chance. Okay, that this medicine, the house cinchona, was discovered, that it was by chance only that some physician employed it and got the result in 9 out of 10 cases, and they told that this cinchona is specific for malaria, okay, this type of fever. And these specific were sometime, that is another topic, sometime dangerous. And then homeopathy solved this danger matter with introduction of minimum dose. But this by chance, happy-go-lucky nature of discovering specifics, this problem was solved by homeopathy with drug proving. Okay, one solution was with Paracelsus, that doctrine of signature they were using. Okay, before Paracelsus and Paracelsus like-minded physicians were using, for discovering this specific, they were using doctrine of signature. I like Euphrasia's plant was I like, means leaf or with the structure of I, they were using for ailments in ailments of eye or complaints of eyes. Okay, for blood they were using red plant or red things. This was doctrine of signature. One method, one was by chance, and one was by doctrine of signature. Yellow for jaundice. Okay, they were using yellow for jaundice or liver affections of liver. Okay, this was another method of discovering those specific. But homeopathy completely revolutionized this method of discovering a specific by drug proving, giving a medicine to a healthy person, noting down the symptoms. Okay, now this symptoms, this records I'm having, I will match this record with the disease. If I found disease like that I'm having, I will employ this medicine. Okay, so scientific disease, so scientific this was, that doctrine of signature sometime dangerous, that by chance discovering, how long you have to wait for discovering by chance, trial and error method. So this drug proving is completely a new method of discovering the therapeutic effect of medicine to homeopathy. And this is one of the contribution of Hahnemann to the medicine. Original contribution of Hahnemann, though Albert von Heller have thought this before Hahnemann, and Hahnemann have given due credit to him also, but this is completely scientifically devised by Hahnemann himself. Okay, so 100.05 is the knowledge of, from here the knowledge of medicine in general starts. Okay, we will refer it now. Please read 100.05 105.
The second point of the business of a true physician relates to acquiring a knowledge of the instruments intended for the cure of the natural diseases,
Underline
investigating
this:
the
acquiring a knowledge of the instrument intended for the cure of natural disease.
investigating the pathogenetic power of the medicines in order, when called on to cure, to be able to select from among them one, from the list of whose symptoms an artificial disease may be constructed, as similar as possible to the totality of the principal symptoms of the natural disease sought to be cured.
Okay, so underline pathogenetic power of medicine, underline to be able to select. Okay, I have list of symptoms of artificial disease. I have artificial disease with me. I will match with the natural disease. And which artificial disease is meeting the natural disease, I will give it. Okay, this natural disease, this is artificial disease. I am trying to make it similar. This is not similar. This is not similar. Mirror image is similar. Okay, as similar as possible. As similar as possible. This is not similar. This is similar. Okay. Next.
The whole pathogenetic effects of the several medicines must be known. That is to
Underline
say,
this.
all the
Whole pathogenetic effect, several medicines. That is what our Materia Medica is comprises of. That is the Materia Medica Pura is containing altogether 99 medicines, or Hering's guiding symptom, or means Allen's, uh, this, what is that? Uh, Not Allen's 10 volumes of Materia Medica. Okay, TF Allen's, TF Allen's Materia Medica, 10 volumes of that. All those are whole pathogenetic effects, recording of whole pathogenetic. Our keynote, Allen's keynote, Nash, Boric are not whole pathogenetic effect, but these are the short of that. But whole pathogenetic effect should be known to us. Though we are reading these keynotes and Boric's Materia Medica, but it should be in possession of the profession. Okay, it should be in possession of the homeopaths that yes, there is, I know there is somewhere the whole pathogenetic of Brainia have been recorded. Okay, each and every single that Brainia is able to produce have been recorded somewhere, and whenever I want, I can look there for that. Okay, so this is completion of drug proving. Completion of drug proving. 135. Go to 135 and read that.
The whole of the element of disease a medicine is capable of producing can only be brought to anything like completeness by numerous observations on suitable persons of both sexes and of various constitutions. We can only be assured that a medicine has been thoroughly proved in regard to the morbid states it can produce, that is to say, in regard to its pure powers of altering the health of man, when subsequent experimenters can notice little of a novel character from its action, and almost always only the same symptoms as had been already observed by others.
Okay, underline completeness by numerous observation. Underline numerous observation on suitable persons of both sexes. Underline this, and various constitution. This is important. Only then you will have a complete sphere of action, a complete means picture of drug, because they differ, constitutions differ, a sexual sphere differs. You cannot expect a female symptom of that drug, it will be produced in the male body. That is not possible. Okay, so you have to prove it on both sexes plus on various constitution. Okay, that is why some of the authorities are advising to prove it on children also, because children differ so much, because their hormonal constitution means hormonal balance in children is different from the adults. Okay, so children differ from adults, so some of the authorities have advised to prove drugs on children also. Okay, and one of the blockage we are having for that medicines cannot be proved to up to that extent that it will produce pathology. Okay, that blockage have been covered by records of poisoning. Okay, or from animal proving. In the human provers, we cannot induce a medicine up to the pathological proving. So suppose Brainia have array of symptoms. We are having lots of symptoms of Brainia, but we are not having in human prover, we are not having the pleurisy of Brainia. Okay, in human prover, we are not having the tuberculosis of Drosera. Where it has been proved, either it has been coming from the poisoning, record of the poisoning, as you will get in TF Allen's Materia Medica. Okay, or from the animal proving. Nowadays drugs are all means being proved in animals also, from the animal proving. Okay, where from this Drosera tuberculosis have came from cat proving, that cat is known to immune to tuberculosis, and in them Cats are immune to tuberculosis. They never suffer from tuberculosis. But in them also, Drosera is producing tuberculosis. Okay, so that is coming from animal proving. So complete symptom of a drug from proving on human being, we are almost completing the symptoms, almost completing the extent, the whole picture, the whole pathogenetic effect, but remains what? The pathological, the poisoning effect of that drug, and that have been covered by records of poisoning, accidental poisoning, and by animal proving to some extent, from clinical observation also. Okay, to some extent from clinical observation also, that in that particular disease, in that ulcer of the stomach, we have used this medicine and that ulcer have been cured. That means this medicine is capable of producing that kind of ulcer in its pathogenetic effect, complete pathogenetic effect. Okay, so underline that completeness of numerous observation on suitable persons, both sexes, various constitution. Why sex is important? We have told that different sexual spheres, different hormonal balance in different body. Okay, male cannot have female symptoms, or female cannot have male symptoms. So that this female proving like sepia was mostly proved in male patient, male provers sepia, where from these female symptoms were later on it has been devised, that it has been told that sepia is predominantly a female remedy. Sepia is predominantly a female remedy. Okay, later on by clinical observation that it is working good. Mostly most of the prover of the sepia was male initially. Some females were there, but initially they were males. But later on, from the clinical observation, it was found that sepia is predominantly a female remedy. Lycopodium, from clinical observation, it was found, and from proving also that in male provers, it was giving lots of symptoms than in female provers. So Lycopodium, it was found that it is predominantly, from clinical observation, it is predominantly a male remedy. Clear? But one interesting point I want you to note it down, that when a predominantly male remedy indicated in predominantly male remedy is indicated in a female patient. What I'm saying, a predominantly male remedy is indicated, well indicated in a female patient, that will work wonder. Okay, a predominantly female remedy indicated by its characteristics in a male patient, that will work wonder. That is more characteristics. Like you will see Lycopodium often indicated in aged, second means middle-aged women, or women who are in controlling condition in the family. You will see that they are more giving Lycopodium like symptoms. In controlling position in the family, you will get these ladies, these kind of leaders in the village setup, that where a household is being dominated by a female, and that female often will give you the symptoms of Lycopodium. Okay, one of the case, one of my colleagues shared with me that she prescribed Lycopodium on a lady that was menstrual, with a menstrual irregularities, or the menses were absent for long. That was not a middle-aged lady, but or 30 or 20 years of age, between means mid 20s, and absence of menstruation was there, and other symptom plus other symptoms were there, and she prescribed Lycopodium and menses returned. Okay, no one can think in that fashion that they're predominantly male remedy, if a female patient is showing the characteristic symptom of that, that will work wonder. Okay, that is a side topic. Anyhow, we were discussing the sphere of action, completeness of proving, or completeness of pathogenetic, all the pathogenetic knowledge of all the pathogenetic effect a medicine can produce. We have discussed What is constitution? We have discussed the sexes, and we have discussed the poisoning effect, the pathological effect that is being fulfilled by the record of poisoning plus the animal proving. Okay, clear? I hope this portion is clear. Now 106, go to 106 and complete it.
All the morbid symptoms and alterations in the health that each of them is specially capable of developing in the healthy individual must first have been observed as far as possible, before we can hope to be
As
able
far
to
as
find.
possible. As far as possible means, I mean, pathology, we cannot push the patient to pathology. As far as possible, we have to observe them in a healthy process.
Before we can hope to be able to find among them and to select suitable homeopathic remedies for most of the natural diseases.
Okay, so this pathogenetic effect in its whole extent should be known. Brania is known to produce 1500 or 1400 symptoms. All the 1400 or 1500 symptoms should be there. It should be wholly proved, plus those effects of poisoning and animal proving. Okay, any question you want to ask? We will continue from 107 onward next day. Any question you want to ask? Anyone having any confusion, any question, can ask. Okay, thank you everyone for giving me your attention.